Community conversation meetings were held in each of the 9 parishes the foundation serves. 150 people attended. The goal was for them to learn about the things that impact health in a community and introduce tools to initiate change. County health rankings and roadmaps coaches introduced community members to various factors that influence how long and how well people live, the rankings data for their parish, and also how to identify health concerns and prepare an action plan. At the end of each meeting, these community advocates identified the top issues they felt should be addressed in their parish.
I was very surprised that Allen Parish actually ranked 16 out of 64 parishes, so we were at a very good place to continue to improve. I found the data to be very accurate and very reflective of what we're experiencing here in Allen Parish. We definitely have a shortage of primary care physicians. We also have a big group of our patient population that are either uninsured or underinsured.
It's going to take a whole community. It's going to take input from every walk of life and every age to see that our young children and our older citizens are taken care of.
We had such a good group of people from different agencies that met, and we discussed all the different things that could probably work on to improve those things. Diet, exercise were some of the things. Diabetes, that was a really high diabetes rate in Vols Parish, and it's pretty much the same as the state also.
When we were networking in the groups, I learned a lot of different programs that help the children with drugs, with alcoholism, to be able to have resources, to be able to give them a successful life. And also in networking, we learned about programs that helps with mental health that we're not always so comfortable in talking about, and suicide prevention, and that's very important when dealing with the youth.
What stood out to me, one thing is the strong agreement, the importance of education in leading to improved health of all individuals, education from birth through adulthood. I also was very pleased with just the community involvement and the commitment of each of us in this room to work hard together to improve the overall quality of health in our communities.
Well, what stood out to me today was all the areas that were covered and all the concerns that's in our parish. I think community involvement and education, that's what we're striving to do, trying to get more community involvement. And our areas of need, our areas of improvement, and just some ideas that they bounced around on us that can help us. I was wanting to have more community involvement, so my mind was thinking on some people that I would want to address and let them know what was discussed today in my community.
I feel like that everything is intertwined. Our problems, our education, our employment takes care of education, vice versa. Our family social issues. We are always looking to improve here in Grant Parish, and the needs of the people is what's important to me. And again, goes back, that includes education, health care, jobs, it's just all of that.
The information that we received tonight about Grant Parish and the report brought out some key indicators, and those are areas that we've tried to focus on in the past. One being family, community support, and how we can reach those families and their needs. Well, I see this directly correlating back to something that we do, which is looking at the barriers to educating our children and that family support mechanism. And we do already have a program in place where we're looking at how we relate to the families and how we assist outside of the needs that are just at school. And the correlation between this project and what we already have, I see meshing into one and only supporting the other.
With health issues relating to unemployment and income inequality, we thought in our group that a diversification of job opportunities here would be appropriate and beneficial. A lot of times when you're focused on one industry, like we are here in the parish, pretty much the oil and gas industry, when that industry has its down cycle, which it does, it affects people not being able to afford their health care, people losing their insurance. So a little diversity in the job opportunities here in LaSalle would be a positive.
I think I took away that we identified 3 things that would be something we could direct our energies to and work as a community. And I found too that it was very refreshing that we did all work together as a group well. And I think it kind of talks to us as a healthcare organization about the things we need to focus on to help our folks in our area.
The parish roadmap that was presented to us, got a chance to look at all the trends and statistics that we see here in the parish, and seeing is believing. I got a chance to see and look at what we could do and where it brings things to a reality so that we can really see that we are working towards some things, but there needs to be a lot more improvement in other areas, and that stood out to me tonight.
I think the biggest thing that stood out to me today is how all the data is related. Basically, one point, fluctuates based on another point. And I think for us, that just gives us hope that if we make a small change in one area, that it really affects everything over the grand scheme of things. And it really shows that we're hitting the right areas of focus. And that's good, because I think at the end of the day, you want some reassurance that you're doing the right things in your community. And this just shows that if we focus on that area, some other areas will also come along with that. And that's really awesome as a community as we progress and grow.
The studies show that the more a community, a family, a parish is educated, the better they can be employed. The better they're employed, their higher quality of living through a higher wage, and the better they can take care of their own personal and family health.
As I reviewed the data that was presented to us, I was surprised by some of those items on there, but the majority of those items on there, I was not surprised by what I saw. And because of that, I'm glad we had this conversation today that now focuses on those things that we already know about, and now we can begin to identify who can be the leaders, can do that. I believe that we become what we believe. If we believe that we can make changes or make a difference in the community, we just need to decide on what's the process going to be to make that happen.
Well, the overall data that we received through this class, what stood out the most was the single family or single parent families at 46% in our parish, which is pretty much half the families in this area, which is a frightening figure. And that probably stood out the most among what we saw. Well, for our area, it's probably education, bringing up education or starting younger with education and getting the youth to where they can get better employment, better income, which leads into better family situations.
I'm in healthcare, so access to care is something that's dear to me. And in HP Long, what we do have is just ability to care for the community by taking care of those who are uninsured and those who are in the Medicaid population, and which is a challenge in the Rapides community. So we feel that we're doing our role in addressing those matters, but it still stands out that that's a key challenge that we do have.
There were 2 things that really made an impact for me, and one was a good thing, one was a not so good thing. And the good was that the 90% graduation rate for our schools. The part that really upset me was the tracking of the mammograms and the diabetes diagnosis and treatment. I thought for sure, having been my life saved by a mammogram, because breast cancer was detected early, and that was, praise God to say, 17 years ago. So I feel like maybe back in those early years, I really was an advocate for mammograms, so now I'm going to recommit to step up. I'm going to try to do a better job of encouraging women not to miss their annual mammograms.
I feel that as an Army spouse, just having exposure to other areas and seeing things done in different ways kind of provides me with a unique perspective on a lot of different things. So one being, I volunteer a lot for the school districts here. And so as a military spouse, and military families in general, we're able to bring our experiences from other states, countries, and hopefully improve where we can, not only for the betterment of the military families that are involved, but hopefully for the entire parish.
Well, I think one of the things was everybody in attendance kind of had the same ideas about some of the data. We all see the common goals and themes that we have in our community. Our school-based health programs have vastly improved I feel like some of the health in some of the communities. The absentee rates are down. We're immunizing children. It's not just urgent care, it's also preventative care. And we've just got more ability to reach out and do things for our patients than what we had before the expansion of Medicaid. You know, Louisiana's had a big shift in healthcare in the last 2 years, thankful to the expansion of Medicaid services, providing more access to our folks. So I think we're going to notice a big improvement when it comes to actual healthcare over the next 5 years than what we saw in the previous 5.